Hello and welcome. My name is Kristen Boggs, and I'm director of the Alabama Albert Schweitzer Fellowship. If you're watching this, then it means that you are thinking about applying for our 2021 cohort, and I'm so excited to hear that. It also means that you realize that a Schweitzer Fellowship experience is built around this idea of creating a project that will address an unmet need in the community. So the first question at hand is always, what are the unmet needs in the community? COVID has obviously exacerbated a lot of problems that were already existing, and it's also created some new needs. So we wanted to share with you some thoughts that other members of our community who are on the ground affecting community change on a daily basis of what they're seeing and ideas and thoughts that they had for you as you consider applying. Now, you are not limited to their ideas. But I think what you'll hear and the way that we've tried to group their feedback is that there are going to be at least 4 main ways that you can make a difference. One is that there are going to be some needs that continue to exist, specifically due to COVID. There are also physical health, mental and social well-being needs, and then also many social determinants of health that need improving right now. So as you listen, we hope this gives you some ideas and inspiration for your application. If you're watching this live on November 10th, we encourage you to participate in the Q&A that's taking place in this YouTube live activity. And if you're not, then make sure you watch until the end. Our contact information will be posted there, and we welcome to have a discussion with you afterwards as well. Thank you again for your interest in applying and for being willing to be the change that our communities need. All right, so Gus, thanks for joining me. Can you start, I guess, just by telling us who you are and a little bit about the Community Foundation's work?
Sure, I'm Gus Heard-Hughes, VP of Programs at the Community Foundation of Greater Birmingham. You want to know about our work sort of generally related to COVID in this current time frame or broadly?
Well, why don't we, I guess, specifically focus on COVID in this current time frame?
Yeah, so you know, we are a foundation that's been in the community here for over 60 years. We do competitive grant making around some key priorities. We have some larger initiatives that we work on. And we have a new 10-year strategic plan. It's not that new anymore, but it's new in the sense that COVID has sort of taken us in a different direction in terms of really beginning to implement that. It's all built around 5 core priorities, which are still pertinent and I think still relate to a lot of our work in 2020. But in terms of our competitive grant making, like a lot of funders, we fully shifted back in late March, early April to COVID response. I think we just felt that the landscape had completely changed, and what organizations were doing and what they needed were just totally different than they were 3-4 months before. So functionally for us, what that meant was we gave organizations the option that if they had current grants to shift them to other purposes. We suspended our regular grant cycle, which we were in the middle of, and went to full 100% COVID-related grant making. So we called that phase 1. That was a really tight cycle, weekly cycle of grant application review and approval. And we made weekly grants over a period of time from early April to early June. And then phase 2 was stretched out more and looked a little bit more like a regular grant cycle. And phase 3 is which we've just launched, is similar. But you know, I've mentioned these 2 surveys that we've done. They were in March and May to hear from nonprofits kind of what community needs they were seeing, and what organizational challenges were they facing. And that really has informed our response in phase 1 and 2. We talked about doing a third survey, but we decided to wait until after the end of the year, probably early January, to see how organizations sort of landed at year end, just because year end fundraising is a big question mark. And I think we'll have a better sense of how things are shaking out, and also how sort of community needs are evolving. So we really have based a lot of what we've done on those first 2 surveys. Now we're talking to organizations, and we received a lot of applications in phase 2. So that's giving us some more data also on what the needs are and how organizations are adapting. But I would say broadly, we've worked really closely with United Way in this, and so we've talked a lot about sort of overlap between what we're learning from nonprofits and how we're prioritizing our grant making. I'd say there's some, modest differences, but largely I think the themes are the same, which are, job and income loss is, I would say, a growing concern right now because of a lot of things, sort of the deepening and ongoing impact of COVID, federal funding and sort of crisis-specific support wrapping up this summer and not having something new come in. So, CARES Act funding, which has covered a lot of bases from everything from business support that's helping keep people employed, and that includes nonprofit support, to supplement to the monthly unemployment benefits. That's gone and hasn't been renewed. And so I think the feeling among nonprofits has been since late spring that we're going to see some deepening of economic and related impacts of this crisis. And I think generally that has been true. And I think that's clearly going to continue into 2021. We don't know what's going to happen there. But in our survey, job and income loss was the top concern or community need people were seeing. Basic living expenses was the second, which is pretty tightly related. But things like rent, mortgage, utilities, food, those sort of basic access, basic things. I know 211 is seeing a lot of those kinds of requests. And then, for us, mental health was the third item. There's a lot of, related items, health, primary or physical health care, transportation, childcare is a big one. We've done some proactive investing in childcare. So, sort of the supports that help keep people employed and help them navigate a very different system where you have virtual school or blended and trying to deal with having kids at home. Education's another area where we've made a lot of grants. So I think all these things are pretty tightly related. And you probably heard some very similar things from Ryan. I think the other part of this is what kind of strains organizations are seeing. And you can, there's some pretty good data in our last survey that you can reference, but actually a pretty high percentage of organizations have applied for and received PPP funding. I think that's been a helpful stopgap. It hasn't obviously sort of filled all the gaps. A lot of organizations are seeing those that get some kind of earned revenue have lost a lot. Those that do fundraising events, which is most, have lost. And then just year-end giving. I think some organizations have actually seen level or increased giving, but I think generally speaking, revenue is pretty significantly down. And I'm concerned about sort of next year where organizations are as the sort of immediate stages of the crisis have abated, but there are still impacts of the crisis ongoing. And what is giving going to look like? What are needs going to look like? Obviously, organizations have had to adapt to providing virtual services or services in different ways. There's been a lot of PPE needs, and these are all things you probably know. But I guess that's a lot of information. But I guess my thinking about this in terms of Schweitzer Fellows is that the needs organizations are seeing in the community and their needs as nonprofits are very different than they were a year ago. And I think in a lot of ways, for a lot of organizations, a fellow could provide some capacity to do things that they are stretched to do right now. We really are not a provider of operational funding typically. You know this. I mean, we make strategic grants, which could be a lot of different things, but we don't provide general operating support. But we've really sort of set that aside and are doing that because I think the reality for most organizations is just to hold steady or to continue to provide services, even at a lesser level than they did a year ago, is challenging. And very few organizations are starting kind of new projects or initiatives unless it's something that helps them adapt to COVID conditions or COVID-related needs. So to me, that's just such a huge overlay to everything that, and I really, I mean, I don't know what's going to happen next year. It's really, nobody knows, but my best guess is that it's going to be a difficult and very COVID-influenced year, just like this year was.
Well, if nothing else, I think I hear you saying we need to be adaptable and flexible and, really take the cue from those organizations that are on the ground, and that it might take some more time. I mean, I think as applicants are thinking about what they want to do, I think we need to acknowledge that what we think the situation is now in October or November may be very different from when they apply in February, from when they, really get started next May or June. So
yeah.
I think
that's
also
a good point.
Trying to figure out how do we structure it in a way that is thoughtfully planned, but that is also doesn't exclude sort of, pivots to what we're seeing the needs as they emerge. So thank you for that reminder. Well, we hate to hear that the needs are increasing, but I think it's good to know at least and acknowledge what those are. So we'll certainly be sharing with applicants what you've told us. And like you said, we'll be talking to a few others and letting them know, letting students know what they say as well. And then if you don't mind sharing that survey data, I'll kind of drill down into that and pull out some things related to these kind of 5 or 6 themes that you've mentioned that you think are going to be continuing needs.
Okay.
So.
And I'm glad, when we do the survey in January, we'll make that public too, and I'll be glad to share that update.
Yeah, I'll put a note of that. I'm sure I'll receive it and we'll participate, but I'll also look for those results when they come out.
Great.
Okay. All right. Do you want to maybe start by introducing yourself and letting everyone know where you work, what you do there?
Sure. My name is Ryan Parker. I work for the United Way of Central Alabama, and I manage all of our initiatives related to health. So that we have a coalition called the Health Action Partnership. We have a coalition called the Bold Goals Coalition, all of which kind of look at just comprehensive community health and look at things related to education and workforce development and things like that. So I manage the health side of those coalitions.
Awesome. And so speaking of help, we're hoping to advise our applicants so that they know a little bit more about what United Way and other agencies are seeing as the needs. Can you tell us sort of since COVID hit, what's been most pressing in the 5-county United Way region?
Sure. So there have been a lot of needs that have come up due to COVID and the economic struggles that have been the result of that. I think the biggest need that we're seeing is kind of those immediate crisis response type of things. A lot of the work that we do is crisis response, and that typically looks like a fire or a tornado or some type of natural disaster. This is just kind of a continued crisis, and we've just seen elevated numbers of people who are dealing with hunger. The numbers of people who have accessed food at food pantries and food distribution sites has essentially doubled from last year, and the expectations are that it's going to remain elevated, maybe not to that level, but definitely higher than it was previously. With the unemployment numbers, we've had over 165,000 people in Central Alabama file for unemployment since March, which is just a really incredibly high number. And when you think about the things that go along with that, people just having a hard time paying their bills, paying their utilities, paying their rent, their mortgage, things like that. So we've seen just increased calls at our 211 service for people that are needing just assistance paying for their bills. So basic things like food and housing and just paying for bills has been kind of the immediate needs that we're seeing. And then a lot of our United Way agencies that serve people in the community have said that those basic things that you typically see after a natural disaster, they've seen just continuing for 6-7 months now, and it hasn't gone away. I mean, it spiked immediately once the pandemic really hit in mid-March, and like I said, those numbers have gone straight up, and they've kind of just stayed at that level for an extended period of time. And so the crisis response, those immediate basic needs, has been kind of the current the things that we're seeing the most need for right now.
And in terms of trying to look ahead, and I know it's super hard to know what's going to happen in the months to come, but do you have any sense of how the needs may shift? So it sounds like those will continue to exist, but are there any new ones that you'll expect to see in 2021?
Yeah. So the current crisis, I think those immediate basic needs are going to continue to some level. It's going to be elevated than it usually is. So that's going to continue. The expectations are. I'm not, the best person to project into the future, but that's what people who are, smarter than me are saying. Other things that we've been working on that we expect to kind of probably spike as well, things related to mental health. So when you say mental health, things like anxiety and depression and levels of trauma and even substance use. The numbers have increased since the beginning of the pandemic. So, nationally, the CDC projects, 1 in 5 people pre-pandemic were dealing with some type of mental health issue. They're now projecting that's 2 out of 5. So it's essentially doubled as well. And then when you consider all of the factors that people are dealing with now related to, social isolation, health fears, unemployment, just lots of things that people are struggling with, that there's pretty clear increases in mental health needs, and that's projecting to probably increase as well. And that's across the board. That's all ages, that's all demographics, all geographies. It's not isolated to one particular population. Everybody is struggling to a certain extent right now. So I think mental health issues are going to continue. One of the things that we've seen a lot of our partner agencies struggle with is they provide maybe after school programming or maybe in school programming for kids. The groups like, the Girl Scouts, Boy Scouts, people that go into schools and provide tutoring or mentoring, things like that. They're not able to do that because of just safety precautions at the schools. And so a lot of those programs are just not happening. And then a lot of kids are learning virtually or remotely, or they have a hybrid schedule. And we've just heard a lot of stories about kids who had not logged on like 9 weeks into the school year because they didn't have a device or they didn't have Wi-Fi. So, I've heard the state superintendent a few months ago, just on a webinar, say that he projects they're going to be working to get kids caught up for the next 5 to 10 years, which is just pretty incredible. When you think about the fact that the spring was cut short for kids, they didn't really have any summer enrichment that they typically do. A lot of them are not in school now. And then not knowing what's going to happen in the future, it's going to be probably, off and on, maybe in school, out of school for this school year, maybe even part of next school year. So there's just going to be a lot of kind of learning loss that kids are going to be dealing with. And that just has, lots of implications down the road. So that's something else that we've heard a lot about. There's, organizations trying to transition to virtual programming and doing it, at reduced rates, not having as many kids in their facilities. And, just when you think about the supports that offers to kids, not just in terms of, development academically, having that academic support, but just being surrounded by it, just the social aspect of it. A lot of those programs provide food for kids who need it. So there are just lots of social supports that go into those type of programs that, because they can't offer them right now, are kind of the kids just aren't able to access those things. And just, missing that for a year potentially just has some huge long-term impacts in the lives of those kids and their families. So that's something else that we've seen a good bit about. One of the things, the programs that we run is Meals on Wheels program. So when you think about social isolation, one of the populations that's really in need right now is seniors. We've seen increased calls, people trying to get on that access to that program. A lot of people access senior centers to get meals every day. Those have closed because of safety precautions. So we've just seen an increase in, hunger across the board for all populations, but seniors in particular, we've really seen a need for, because they are, most vulnerable due to the virus, and they're taking lots of safety precautions, staying home. But the offset of that is that they don't get that's the social isolation of being in the senior center, seeing their friends, getting the meals. And so that's kind of another population that I think we know this is hitting pretty hard in terms of just the numbers of how the virus is impacting their health. But when you think about things beyond that, where they may be just isolating at home, there are lots of things that go along with that as well. So those are just a handful of things that we're seeing, that we're hearing about. Every agency that we serve to some extent has changed the way they have to provide services, and they're shifting to virtual, doing in person if they have to do that as safely as they can. And a lot of times that means they're just serving fewer people because they have to just accommodate, they have to be able to address the safety issues. So that's something that everybody, I think, is struggling with. I don't think anybody's really transitioned perfectly to a virtual setting, and it's just hard to do social service, and healthcare services virtually, and some of that needs kind of the more in-depth in-person interaction. So just trying to navigate through that and figure out how to do that well.
Any other advice, I guess, you would have for students as they think about trying to come alongside and partner with the community at this unique time?
Yeah, I think that that people are really just trying to figure out kind of this new environment that they're working in. And from what I've seen, people are open to new ideas and new thoughts about how to do things. There's just the social service, healthcare is so kind of rooted in in-person services that to shift from that, to figure out how to do that well, has just been a challenge for a lot of people. So yeah, I think the needs are great. I think there's, every industry is to some extent kind of trying to navigate this. I think social service and healthcare in particular are really, in some cases having a hard time figuring out how do you make that. So, I think the advice that I would give is just to be open and creative about ways that you could address this. Look at some of the needs, do some research about the needs that are out there. And, I shared a handful of them, but there's a lot more. And just to tap into some of that creativity and think about how can the model that this organization or this program has operated under change or shift to do it differently. I think this is a time when people are willing to do things a little bit differently and to be open to new ideas. So I think people that are applying to be fellows, just having that mindset and going into it with bringing some fresh ideas. I think that now is probably anytime that I remember, at least, people being open to those new things. So, I think just doing a little bit of research about what's out there. I think people probably are already doing that, already know about it. There's plenty of news stories about the needs, but just to be thinking about, some ways that they could potentially offer a program, offer a service, even on a small scale that could do things differently, that could have implications for that organization or that program in the future. I think there's a lot of willingness right now for people to experiment. So I would encourage them to be creative.
Well, thank you again. We know you're super busy. Do you mind, I guess, first just telling people who may not know you, who you are and where you work?
Sure. Hello, everybody. I'm Bryn Manzella. I'm the Director of Quality Improvement for the Jefferson County Department of Health.
And so obviously JCDH has been on the front lines with everything happening with COVID. And that's part of the goal, I guess, of these videos is to help applicants know, how COVID is sort of affecting the needs on the ground. And then if you had a crystal ball and could look into 2021, if you have any advice for what you think are going to continue to be the needs. So I'll just let you share what your thoughts are on either of those questions.
All righty. Well, here are some thoughts I have. I think as we continue with the COVID-19 crisis and we are all getting sick and tired of all of it, we're going to need innovative strategies to help increase the use of masks outside of legal orders to do so. So innovative ways to reach populations with why to keep doing masking, continue social distancing, washing your hands. Also, again, I think as we go through the next year, innovative strategies to reach groups who have low uptake of vaccine, whether that is the flu vaccine, the seasonal flu vaccine, HPV vaccine in young people, regular vaccination in children, or as we hope will be coming in the next 6 months, COVID-19 vaccination. And again, another thing that we've really seen an uptick of during the COVID, and I don't think this is a surprise to anybody, is there's been a significant increase in the experience of depression and anxiety in our community at all levels. Everyone from small children who are just not sure what's going on with the world, school-age kids who are missing the normal part of their development where they have other kids around and get to be kids and go outside and play and do group projects, to our college students whose trajectories have been changed and altered through this process and plans they have had are now going on hold, to adults and at all levels, and maybe particularly in the adult group for our seniors who are, especially if they have underlying health conditions, are pretty isolated these days, and our first responders and healthcare workers who are on the forefront every day of the pandemic, sometimes feeling pretty helpless. Another thing I think kind of tied into that is, we are working in a different world. Here we are on a Zoom call where normally we would be meeting together. It's helping people increase the literacy, the technology literacy, to be able to use Zoom and to use other mechanisms for social media for communicating effectively, because there's a tremendous amount of people out there that this technology is not native to them at all. They may not have grown up computer literate, and so that's sort of a life kind of changing thing for them. Another issue that we're seeing, of course, growing in our community is violence, which again may be related to anxiety and depression, but may also be related to other things as well, including loss of employment. But I think any type of innovative strategy that we can to give people alternatives to deal with those kind of emotions and to help people understand that if you are the victim of a violent activity, retaliation isn't really the answer. So there's some of the things there. I think some of the other stuff, Kristen, just hasn't gone away. I mean, we are still dealing with obesity, poor nutrition, maybe enhanced poor nutrition. With the loss of jobs and opportunities, our number of folks who are hungry and malnourished is increasing. So again, work to help people, link people to existing resources, I think is important. I think you've probably heard on the news and everyone hearing this about the tremendous increase in substance abuse deaths. Again, we're using drugs as a coping tool for everything else that's going on in our lives right now. And again, finding ways to find healthy alternatives to those drug use and ways to connect people to treatment, particularly not face-to-face. So those are, I guess, some of the top of my head things. I think health equity is a continued issue, Kristen. In fact, if anything, the COVID has helped bring that to light. In some ways, it's pointing more here locally at Hispanic individuals other than African Americans, but both groups have an elevated death risk, which we did not see early in the pandemic. Early in the pandemic, it was whites who were dying disproportionately, but now it has shifted to that. And there's some potential thoughts on why that might be happening. But I think some good public education and support can help mitigate some of those causes as well.
We'll be encouraging our applicants to think about ways they can do projects in a socially distanced fashion, just under the assumption that the early part of 2021 is going to be similar to 2020 and that we just can't predict when, when that won't be necessary, I guess. So do you have any, I think obviously our 2020 fellows had to sort of adapt to that way of thinking midstream. So we're just trying to lay the groundwork now for students so that they can see how can they, still view this as a direct service experience, but do it in a way that's going to keep them safe, that'll keep their participants safe. So do you have any advice just about kind of shifting the delivery model in a way that meets, maybe you can use any of those examples you just gave us?
Well, again, I guess that comes back to one of the things I said of how do we increase the literacy with technology when you can't literally be over someone's shoulder to do it. But, I think about myself and how I learn, and I'm a visual tactile learner. So even just really step by step things you can print out, or that you could send someone in the mail. This is how you sign up for this, or this is how you do that, I think could be helpful. I do agree with you. I think that we're probably looking at mid 2021, probably at the very earliest, before we'd feel some decent comfort. And I think that's maybe even a little bit optimistic, given the challenges I think we're going to have with mass vaccination and uptake.
Yeah.
But not to give up, and to, my thing is look at this as an opportunity for your own adaptability and flexibility and helping other people become adaptable and flexible. That's a tremendous gift, I think, to have as a leader, is to be able to morph yourself. But at the same time, I encourage everyone to maintain as much voice-to-voice, face-to-face, or maybe not face-to-face, but like you and I are doing, looking at each other, where we can see body language, so that we don't lose our competency in reading nonverbal language. Because I think that's going to be a risk that we're going to have to deal with down the road.
Well, and for all of us extroverts out there, we need this just to stay sane, don't we?
Well, we do. And this has really been hard on people who are people. It's hard on people who are tactile learners. It's hard on people who need touch to feel valued and loved. It's crazy. I mean, I'll share this with you because Ashlyn we don't hug in the house. My own daughter. But every time I go in for a hug, she's like, Mom, we're not supposed to be doing that. And yet I feel, so it's hard. I mean, you know it, and you go intellectually, I get it. But we all need those comfort mechanisms in times of distress as well.
Yeah.